So here we are in part 2 of our show today about Opioid Awareness Month here in the state of Florida. And just to recap, we're in the studio with Judge Michael Linn from the 19th District Circuit. And we are with Deb Dreyer, who's our Chief Clinical Officer at New Horizons, and Carrie Lester with the Substance Awareness Center of Indian River County. So we're talking about opioids, which has become in this country the leading cause of death. Opioid overdose. And in fact, I have some numbers for 2018 drug overdose fatalities. Now, this does include other drugs other than opioids, but in Indian River County, there were 34 drug fatalities. This is accidental, not suicides. In Martin County, 44. In St. Lucie County, 63. And in Okeechobee County, 9. So that does not include the number of overdose responses that we do on a daily basis. And we can't really keep track of that because each police department and fire department and in every municipality and every county I mean, that's a very difficult thing, correct?
Yes. I mean, it's tough to gather the data that we need. This is a relatively new crisis, believe it or not. It's not 20 years old, so the data systems haven't been established. But what I think is significant is that those numbers that you just said means that there's probably an overdose every 2.5 days on the Treasure Coast. That's an overdose death.
Right.
That's not just an overdose. So I think it's important, and we understand that those numbers are not going down right now. Is that correct, Judge?
That's correct. From the data that I've seen, the drug overdose deaths, especially related to opioids, is going up currently in the state of Florida, unfortunately.
And the reason for that is, I always say, it's not your grandmother's heroin anymore. It's because it's being laced with fentanyl, which is used in end-stage cancer pain in a controlled way. And it's used in anesthesia, and very, very small amounts will make you stop breathing. And so the other thing that we're doing, and I think this is important for Opiate Awareness Month, is that the state surgeon general wrote an order for state facilities to be able to hand out Narcan. Narcan is the antidote if somebody overdoses. It comes in a nasal spray.
Not a big injection needle that you stick in your heart like the movie show.
I mean, EMTs will carry the injection. Most police departments are now carrying Narcan in a nasal spray form. And if you have a loved one that is a user, you can come to either our facility, New Horizons in Midway Road, or to Substance Abuse Center, and I'll let you give the address in a second, and you can come and ask for training and for the Narcan, and we will give you a box. You can also get it at CVS and Walgreens, although it's quite expensive.
It's like about $99.
I think it's a little more than that, actually. So it really is. It's a nasal spray. It's easy to administer.
And the training is only a 10-minute video, right?
It's a 10-minute video, yes. So we encourage anyone who has a loved one, it's harm reduction. Because once they die, we can't treat them. So we're just doing everything we can to try to keep people alive long enough to treat them, whether it's through drug court, whether it's through just coming in for treatment, whatever it takes. We want to save those lives.
The Surgeon General's called us all to be prepared and carry what is called naloxone, and the brand name is Narcan. And the state of Florida has made it very accessible. The goal is to get those Narcan kits out in the community, because that is where overdoses happen. They are not happening in doctors' offices and emergency rooms. And so the more people who are carrying the Narcan kits, it's kind of like we have everyone trained in CPR, and we save lives for heart attacks. And that's what we need to do with opiate overdoses. It's a very simple training. It is as easy as using an Afrin nasal spray, and we at our agency, you can come in, get the training. Within 5 minutes, we'll answer any questions and give you a kit. We will stay with you as long as you need us to answer your questions and make you feel prepared to go out there.
And who do you recommend gets Narcan?
Well, anyone who is at risk of overdosing or witnessing an overdose. So particularly someone with a substance or an opiate use disorder or a family member. But the reality is we're all at risk of witnessing an overdose because they do happen in our community. And so if you're around high-risk populations or out and about in the community, we suggest that you come in, get a training, get a kit, and
save a life.
Save a life, exactly.
So the MAT...
the kits are free.
Okay.
Yes.
I think we said that, but I want to make sure people understand.
And you can come back and get another after. So,
absolutely.
Right. And so in a package, are there 2 doses?
There are 2 doses, 2 nasal sprays. You administer one, turn somebody over on their side, please, because they may unfortunately vomit. We don't want to have any aspiration deaths. And then if it doesn't work in 3 to 4 minutes, administer it again. The thinking is that gives you time to call 911. And for the first responders to arrive. So we're really buying time. I think it's important that we understand that we're buying time and that people often say, are you enabling the drug user? And I want to say, no, we're saving their life until they have the time to go through treatment.
When you understand addiction as a brain disease, sometimes people say, well, if someone knows there's Narcan, they're going to just go get high and they're going to use a lot. But when you understand addiction as a brain disease, there are changes in the brain that are motivating. It's the reward pathway that's being hijacked. And the way people assign priorities and motivation, the brain is now motivated to seek out the drug. The power of choice is gone. People aren't choosing at this point to go get high. The brain is motivated and rewarded and driving the person into that behavior. And so Narcan or no Narcan, someone's going to go get high, and this is our window of opportunity to try to engage somebody into treatment.
I think it's important that we say that if you call 911 for somebody who has overdosed, you will not be arrested.
That's what I was going to ask.
There is a good, that's where I was going earlier and kind of forgot. But anyways, you will not be arrested. So that we don't want anyone to see an overdose and then run for fear of arrest, because that happens way too often, and then people die when they don't need to.
So even if you have drugs there, they'll be confiscated, but you won't be arrested? Ah. So the medication-assisted treatment, so we have that. That is the methadone, the Narcan, the Suboxone, and the Vivitrol. Those are the 3. Are those the 3 main? You also dispense those?
In Indian River County, people can come to our office Mondays at 1 o'clock, and we do a free medication-assisted treatment educational session. And then if people are interested, we'll move on. We'll do a screening. And we partner with Treasure Coast Community Health here in Indian River County, and they provide all the medical aspect. And medication-assisted treatment is best done in combination with a comprehensive counseling program. And so our agency, the Substance Awareness Center, provides that comprehensive counseling program. We have the day treatment program that's highly structured, 16 hours a week of treatment, or an outpatient program. And TCCH will provide the medication. And for those who are indigent, not insured or underinsured, there is a grant fund that we are able to tap into through the Florida Alcohol and Drug Abuse Association, so that everyone has access to these medications.
So I think we need to be clear, though, we're not doing methadone.
Okay.
Yes, we are not either.
Methadone's a different
They have
different
a different clinic and licensing.
Do we have them around here?
Yeah, they're around, but we simply aren't doing them.
Okay.
Yeah.
And so the Substance Awareness Center, does that also do residential treatment?
We do not. We have a recovery assistance program. Our agency has been gifted 2 homes by the generous philanthropy of Indian River County. So we have 1 for men and 1 for women. They're ideal for someone who is stabilized in their recovery,
more like a halfway house.
Yeah, more, but a little bit more structured than a halfway house. But we're looking at someone who's internally motivated for treatment and recovery, stabilized, and then they'll be working on their treatment, and then also really building all the recovery capital they're going to need to sustain their recovery.
Do people working with drug court stay in these
Those
houses?
are very good candidates because of the accountability and the structure of drug court. They do well in our house. We also here in Indian River County have a jail program where we send peers into the jail. They do kind of a recovery outreach and an engagement group to help inmates with substance use disorders start to think about what they can do differently when they leave our county jail. And we educate on medication-assisted treatment. And if anyone in the jail is interested in Vivitrol and a candidate for that, Treasure Coast Community Health will actually come into the jail, initiate what is needed to start the medication-assisted treatment.
That's wonderful.
And then it's a bridge into, a lot of times then that's a bridge into our recovery assistance program. Sometimes if Judge Linn is if there's a sanction that's happening in jail or someone who's not making it at the level of care we have, we are able to kind of try to build that bridge with our homes too.
Yeah, Indian River County is very progressive in that respect. It's amazing and wonderful that the jail is joining with you guys to do that.
It is not very common across the state of Florida, so it's been a neat, unique program. And we are very grateful to the Sheriff's Office.
Deb, why don't you talk a little bit about what New Horizons offers for treatment?
Our treatment is very similar. We have medication-assisted treatment. Our physicians are on site, and they do kind of a whole health thing as well. They'll treat your diabetes or whatever. Because a lot of the people that come in have other health problems, so it's integrated. And we have counseling and we have peer support as
well as a residential program and a detox.
I'm sorry,
unit.
yes. We have a detox and we have a 28-day residential program.
Okay. So where do we go from here? How do we make those numbers go down? Judge.
Well, that is an answer for our legislative branch to try and figure out. I think drug court works. I think it has worked, and it's worked very effectively. It really came about during the cocaine era here in our country, and it has improved a tremendous amount of preventing recidivism or repeat offenders from coming back into the criminal justice system, because we figured out a long time ago just locking people up doesn't make them any better. And that was a fact that I always recognized as a prosecutor, too. I wasn't warehousing individuals to make them citizens of the year. But this is, so drug court works. This is just a new form of drug that's coming along that I think, if implemented correctly, which it is so far, we will see those numbers turn around in drug court. My fear is the drug court has been so successful in the past that perhaps there will be changes coming where they'll broaden the net. They'll say, oh, this is working, so we'll increase the amount of people that can qualify for drug court. And my fear is that I want to make sure that the individuals that are coming into my courtroom are amenable to treatment, not just, oh, I'm going to get my charges dismissed, so I'll play along individuals. Right. It's almost, I guess the best analogy is, if you've got an unbelievable hospital, I'm a Gator, so you have Shands, okay? Best hospital in the state, in my opinion. Well, it works, so why don't we shut down all the other hospitals and just send everybody there? Send millions of patients there. Well, it won't work then. And that's my fear, that drug court might turn into that, is that we are successful, but we're successful in the area that makes ourselves available to individuals that are amenable to treatment, which is where New Horizons and where where SAC comes into play, and they can give that treatment to those individuals. I don't want to see my drug court get so large where it turns into almost a warehouse or an assembly line. That's what I don't want to see.
Did you see the numbers go down with cocaine use through drug court?
Yes.
But did you see them replaced by the opioids?
In my opinion, cocaine's a little bit different than opioids because, frankly, to get addicted to cocaine, you did an illegal act to start off with. Most people my experience has been, most people that get addicted to opioids are people that got injured.
Right.
And then they get prescribed a drug, and it wasn't monitored correctly in this state for years. I mean, we all drove down the turnpike and saw 1-800, pain. And so we knew what was going on, and it just sort of ballooned from there. So this is a different type of crisis that we have on our hands, and I think it will improve over time. And I think the governor, through his executive order that he's released with a task force that he's placed in his office, and as well as the recognition to me from the judicial branch to have Chief Justice Kennedy step forward, take a leadership role, and recognize that and encourage my colleagues to become informed in the troubles of addiction, to understand that and recognize that. So we might be able to help with this in our community and become good tools in our community to be able to help people get back on their feet and get this addiction behind them. I think that benefits our community, which is what we're all looking for.
Right.
So I do think in the future we'll see those numbers go down.
Okay, we're going to take a short break, and we'll be right back.
If you operate a small business, you need services like payroll, tax compliance, HR tools, and other resources. You need Complete Employee Solutions. Vero Beach has a team of professionals, including Anthony Sammons, Matt McCain, and Jennifer Comer, who saw the need for competent payroll, HR, and employee leasing services. Call Complete Employee Solutions at 772-978-7277 or visit their website at CompleteEmployeeSolutions.com.
The Cataract Institute at New Vision Eye Center offers the most advanced technology available for patients with cataracts. Gentle, bladeless, computer-guided cataract removal. Our advanced laser system is designed to deliver the best visual results with unsurpassed accuracy and efficiency. No two eyes are the same, not even yours. That's why we use the very own image-guided system to obtain a fingerprint of your eye before your cataract procedure. Doctors Minotti and Tate offer the safest and most efficient technique for cataract removal and permanent intraocular lens implant. Patients are personally counseled on the best approach for their needs and lifestyle. There are multifocal lenses that allow for distance vision and reading, or toric lenses to correct astigmatism. Call New Vision Eye Center for a consultation or second opinion. Your eyesight deserves world-class eye care. Visit newvisioneyecenter.com or call 772-257-8700. That's New Vision Eye Center in Vero Beach.
Hi, I'm Cindy, the proud owner of Cindy's Cleaning Service. I consider it a privilege to be welcomed to people's homes and offices to make them shine. We do it all from ceiling fans to floors, dusting, and windows. With Cindy's Cleaning Service, you get quality cleaning and affordable rates. We are also licensed and insured. Please give us a call and we will give you a free estimate. Cindy's Cleaning Service, 569-9348. At Cindy's Cleaning Service, the Lord is our strength.
The Green Marlin. Check out their specials all week long. Like Monday, buy a salad bar, get one free, 11 to 3. After 4, get a whole Maine lobster, $16.95 while they last. Wednesday night is Buck a Shuck. Dollar oyster nights from 4 to 7. Prime rib dinners every Thursday through Saturday while they last. The Green Marlin, the biggest and best all-you-can-eat Sunday brunch, too. Family-friendly seafood and more, $14.75 US 1 in Vero. A fresh experience. Go where the locals go.
Welcome back to Mental Health Matters. We are in the studio with Judge Michael Linn, Deb Dreyer from New Horizons, and Carrie Lester from the Substance Awareness Center. Judge Linn, you have a function coming up.
Yes, I do, and I'd be making a huge mistake if I didn't take this opportunity. Our circuit is putting on a opiate awareness presentation. And if you're interested in attending, it is on Friday, July 19th, 2019. It's from 2 to 4 in the afternoon. We have 4 excellent speakers that are going to be there giving a presentation on opiate addiction and being aware of signs of opiate addiction. You do need to RSVP. So if you go to the circuit, the number 1, the number 9.org, circuit19.org. If you scroll down, you'll see the banner for opiate awareness presentation. Click on that link and RSVP. And trust me, if this is a topic you want to learn about, there are people there that are on the front lines. I'm not necessarily on the front lines, but those individuals that are out on the streets in law enforcement capacity or the doctors, they're going to come and talk about opiate addiction and the things you need to look for as a citizen of our community to keep an eye out for opioid awareness and opioid addiction and what you can do to help our community.
Thank you.
I think think along those lines, that's what we're here for. This Awareness Month and Opioid Overdose Awareness Day at the end of August are to help the community understand this as a brain disease, and so that people are less afraid to go and seek help. This is all part of the broader umbrella of the recovery-oriented system of care. We have that kind of in mental health and in substance use disorders, where we see people as being on a continuum of mental health, and we try to meet people where they're at, and we try to join with them on their recovery journey. It sounds kind of pie in the sky, but one of the things that we're using now is peer support as well. I know you're using peers in the jail. Those are people who have lived experience, who have been there, done that.
So they're not necessarily professionals in mental health care or health care.
No, and
their lived experience either as a person with a substance use disorder, they might have lived experience as a family member, they might have lived experience with a mental illness, and they're able to use their lived experience to connect more immediately with someone who is struggling with.
But then they are trained.
They are, yes, they go through a 40-hour training. They receive supervision.
Yeah, and there is a way to be certified as a peer in the state of Florida.
But there's a connection and a trust that can happen, and so people can use their lived experience if they're trained in a way that will help really engage and retain people into recovery.
Isn't that the task force is actually piloting a project with Cleveland Clinic in Martin County. It'll move up, where when somebody overdoses and is brought to the ER, they call and we send a peer over there to talk to the person and try to help get them into treatment before they end up in the criminal justice or any justice system. So we're doing that, and we find that the peers connect much better than we do as professionals.
Only 10% of the people with a substance use disorder ever receive the specialty treatment that they need for that. And so that's where our work in outreach and engagement. And then once you get somebody to come to treatment, how do you retain them into treatment? And the peers have been shown, the research is showing how effective they are at meeting someone where they're at, helping engage them into treatment and keep them into treatment.
So we have actual proof of that efficacy.
Yeah, and that's nationwide. The use of peers has been proven and shown to be effective in bringing people into treatment. And there are lots of programs. There are several programs across the state of Florida and nationally around these emergency room diversions. When someone comes in with an overdose, that's our window of opportunity to say, do you want treatment and recovery?
And we found, and it's evidence-based, that getting someone into treatment is really a matter of engaging them and of gaining trust. And then once we get them into treatment, especially the counseling piece, we can start working on usually the trauma that brought them there in the first place, whether it be psychological trauma or physical trauma. That's usually at the root of most people with substance use disorders.
So is there anything else? You mentioned a task force?
Well, we have the Treasure Coast Opioid Task Force. We usually meet fourth Thursdays at New Horizons at 1:30. In August, we're going to be having, August 15th, we're going to have an opioid awareness activity there where we'll have some booths and treatment providers and information. The general public will be invited.
And then the forum on the 19th, do you know if they'll be talking about childhood trauma and how that relates to opioid addiction? I think that is just
likely.
such a...
I've seen it. I think most likely it'll be touched upon.
I would definitely think they would cover that. I can tell you that the Sergeant Ryan Register from the Sheriff's Office will be there from the narcotics unit. There's a Dr. Kenneth Palestrant, a mom that's lost a child to addiction, is another individual that'll be there speaking. And then there's a treatment center individual that'll be there speaking as well. So they'll cover all those topics.
Thank you so much. And if you want to see this in its entirety, you can watch that on our Facebook page, New Horizons Mental Health. And I just want to thank you so much for being here and sharing this information. It's definitely going to save lives.
Thanks for having us, Lisa.
Thank you.
Thank you.